Most of the time, Allie Allen is smiling, laughing, and full of energy. But all of that changes when she gets a migraine.
I don't think people who have never had a migraine really can imagine that it's as painful as it really is.
Allie remembers dealing with frequent headaches since she was 5 years old. But she wasn't diagnosed with chronic migraines until her 20s.
Well, at that point, they were debilitating. They were on half of my face, half of my head, and they got to the point where over-the-counter drugs wouldn't get rid of a headache anymore.
The cause of migraines is unknown, but research shows an estimated 80% of people who get them have a family history.
It is really very common in the entire population, more so in females than in males, and it's the most disabling type of headache. It's episodic in most cases. Patients will have multiple attacks, and they vary tremendously in terms of how severe. Some are mild, some are moderate, and some are so bad they wind up in the emergency room.
There's just a sensation when they first start coming where you can feel, for me, it's like a tightness, almost like just a tension. And for me, I usually get them in one spot, and when they start coming on, I take something as fast as I can.
Symptoms may include a severe, throbbing headache on one side or the whole head, sensitivity to light, smells, and noises, and blurred vision.
Some migraines are associated with what we call auras. They get a warning of either seeing sparkles or some sort of problem with splotchy vision. And they know from prior experience that that likely is going to be followed within 15 or 20 minutes by a severe headache.
Dr. Gilbert says the most important triggers for migraines are stress, irregular sleep patterns, and hormonal changes.
Sleep is an issue. I know that when I don't get enough sleep, I definitely will get a migraine or too much sleep.
How's the head been doing since I saw you last?
A little bit better.
A little bit better.
To say.
8 years ago, when Allie started seeing Dr. Gilbert, she averaged 4 to 5 migraines per week. And determining a good treatment plan for her hasn't been easy.
Typically, we try to sort out whether a patient needs just acute treatment. When the headache comes, if they're not having very many, we find something that works. And then other patients, like Allie, become more frequent with their migraine attacks, and they need what we call preventive therapy. This is medication taken daily to try and prevent the headache.
I've tried even an Alzheimer's medication. It's just a trial and error kind of thing.
Now, Allie's attacks have decreased to about 4 headaches per month.
This was largely due to the improvement she got from Botox injections because of the frequency of her headaches.
You might have heard of Botox as a way to reduce wrinkles, but it's also used to treat chronic headaches.
And I think that's been one of the major factors in her improvement, as well as her recognition of what triggers there are and what she can do to avoid them.
Dr. Gilbert recommends exercising 4 to 5 days a week, avoiding processed foods, and maintaining a regular sleep cycle to help reduce the risk of migraines. And Allie's advice? Don't hesitate to see a doctor if you're experiencing migraines.
I can't tell you how many times my mother said, you've got to call somebody, you've got to go to the doctor, I'll go with you.
Even after living with migraines for 5 decades, she remains optimistic about the future.
I'm hoping as I continue to age, they will get less and less. That's my hope. It's terrible, but today's a good day.
Tamika Jones, CNN, Atlanta.